Hi, my name is Dr. Ray Kieffer. I'm an orthodontist in the San Diego area. Recently, I gave a presentation to a large group of dentists and dental specialists, and I'd like to make that available to the general public. I hope you enjoy. Now, if we look at the second type of growth that is developing abnormally or out of balance, the class 2 type. Now, here's a young lady where we use our plane where the upper lip is on this plane, but the lower jaw and the lower lip is drastically behind this plane. So what can we do? So when I met Celine, she was 11 and a half. Her chief complaint was her overbite. She had a health history which revealed no health problems, did have a history of mouth breathing while sleeping, and an abnormal swallowing pattern. So here's a photo of Celine and her facial balance. So the clinical findings, when I looked at her and took notes, I found that she had good facial symmetry from the front. She had acceptable head posture, effortless nasal breathing with no obstruction, and a presence of a lip habit. The reason that I put head posture, nasal breathing, just wanted to discuss that a little bit, and also the lip habit. The lip habit, I'll actually break that down a little bit more. I'll show you some photos and exactly what that is. The head posture is an issue that sometimes will allow me to determine if somebody is comfortably breathing through the nose, which is the proper way to develop. When an individual is breathing through the nose, the tongue is on the roof of the mouth. You swallow every 20 seconds or so. Every time you swallow, the tongue flexes, and it helps maintain the upper jaw, the width of the upper jaw. So if you have a nice broad palate, then the teeth come in straighter, and the lower jaw develops more normally. If someone has forward head posture, what they're doing is they're straining forward and opening up the airway. So not only does forward head posture put a strain on the cervical vertebra, but it also helps to open up the airway so they can breathe. So I have in the past done something called a palatal expander where I've expanded the palate. What that does is it allows the floor of the sinus or the nasal floor to drop, and it increases the nasal volume, thus making it easier to breathe through the nose. And upon expanding some kids, I've noticed that their head posture has changed, and consequently they've started to undergo a more normal development. So if you can evaluate a child somewhere between the age of 6 to 8 to make sure that they have a nice sized palate, not only will you make enough room for the tongue, you'll make enough room for the teeth to grow in, and often you'll make it a lot easier to breathe through the nose, and consequently normal development will occur. Now, the other issue that I wanted to talk about was effortless nasal breathing. So a nice way to check that is dentists have something called a mouth mirror, something that we can look inside the mouth of the teeth. If you block off one of the nasal passages and hold a mouth mirror underneath the one that you did not block off and have that individual breathe, if the mirror fogs up, then there's good airflow through that side. Really, in essence, what you're checking is a deviated septum. So if you find this, then that individual is not going to have a normal nose breathing pattern, and consequently could have an instant where the facial development is not ideal. So in that instant, a dentist or whomever is checking this can refer that individual to an ENT to evaluate a deviated septum. So with Celine, then we can discuss the dental findings. So here's some what we call intraoral photos of her. So orthodontists like to evaluate midlines. That's the middle of the upper teeth and the middle of the lower teeth. And typically, if the midlines are lined up, then the facial balance or the symmetry is going to be pretty accurate. Now, again, I'll discuss instances where the upper is off and the lower is off, but that'll come a little bit later on. But for Celine, the midlines are on. And she has a deep impinging bite with a moderate curve of speed. Let's discuss what that means. So a deep impinging bite means that the lower teeth are starting or are hitting the palate on the roof of the mouth. If this gets worse, you can actually have periodontal problems or bone loss behind the front teeth. So it's a nice thing to be able to fix this and what we term open up the bite, create some room between the palate and the lower teeth so we don't have this destruction of gum tissue. That space between the two upper teeth is called the maxillary diastema. If I could show a little bit higher, there's a muscle attachment that attaches the lip to the gum tissue. It's called a frenum. And in some cases, some people, this frenum or muscle attachment will be overdeveloped. And that can create a situation where the upper teeth have a space between the teeth. So orthodontically, if I close that space, that extra muscle attachment, extra tissue will tend to open that diastema back up, that space between the upper teeth. So this is that class 2 growth that I was talking about. If you measure the tip of the canine on top, it is supposed to function between the lower canine and the lower first bicuspid. So this illustrates how the bite is off. The overjet is the difference between the upper teeth, the front of the upper teeth, and the front of the lower teeth. Average distance should be about 2 millimeters, and in Celine it was 10 millimeters. So this is excessive. If we look straight down on the upper teeth and straight down on the lower teeth, this is termed mixed dentition. All it means is that there's some baby teeth on the top one in particular. So a combination of baby teeth and then new ones growing in, as you can see in certain areas. And then on the lower, also a mixed dentition situation. She has 2 baby teeth still on the lower. The flared centrals. Now, this is what the lip habit I discussed previously creates. So when the lip gets stuck behind the upper teeth and the individual swallows, what it does is it tends to flex the lip and keep the upper centrals flared forward. So at rest, when Celine was at rest, her lip was resting behind the upper teeth, and again, I'll discuss this in a little bit as well. So the other thing that I like to measure is the width of the arches. So if I measure from the inside front portion of the first molars, Celine measured 32.5. I like to see a width of 33 to 38, and often this is one of the main criteria I'm using to determine if the individual or an individual has enough width. So Celine was pretty good in width, even though she didn't fall within the mean. On the lower, I'm just measuring the tip of the canines. Celine measured 21 millimeters, and I go by a guideline of about 26 millimeters. Now this is going to vary depending on the size of the teeth, but this gives me just a general reference that helps out. So the treatment plan for Celine was something we call a Herbst appliance. It's a functional appliance that's cemented in. I'll show you a picture of this in a moment. But all it does is it postures the mandible forward. Then we're going to put some braces on, upper and lower, to help straighten the teeth and start to work on aligning them. Generally, I leave the Herbst appliance in for 9 months. Then I'll remove it, put the rest of the braces on, and then I'll finish up. So here's some progress photos here. You can still see the spacing, but the flaring that the upper teeth had is starting to get better. You can see the Herbst appliance. It's if you look this up online, it'll show you maybe a little bit better picture of it, but it's crowns. There's different designs, but I use crowns on the 6-year molars that I take off after 9 months, as I said. And these little arms that look like pistons guide the mandible or the lower jaw forward, so it helps change the profile. Here's another illustration of it. When we're looking straight down, there's the crowns. But this, the appliance itself guides the jaw forward. Now, it's important to use this appliance when the individual is hitting a growth spurt, because what we're doing is optimizing the growth of the lower jaw to help balance the teeth. Now, there are other things that happen too. The upper teeth will drift back, and the lower teeth will drift forward as well to help correct the jaw discrepancies. So here's an illustration of what happens to the profile. Here's Celine in the beginning, and there she is with the Herbst appliance in. So you can see that the lower jaw comes forward, and it helps to balance out the profile. The other thing that this does too is by drawing the jaw forward, it does the same thing as forward head posture. It opens up the airway, and it makes it easier for these people to breathe through the nose. So that's why I like the functional appliance. Bringing the jaw forward helps with the airway, helps create a much more balanced profile and does some other things to help with the growth of the individual. So we'll just go through the final results. There's my photos again of how the teeth fit together. The Overjet now has been fixed from 10 and it's now more in the range of 2. And the back teeth are functioning in what's called a class 1, where they're supposed to function. And the upper arch has been expanded a little bit. There's an example on the lower arch of my lower retainer that I like to cement in on my teenagers. And so from this point forward, I'm asking Celine to wear an upper retainer just at night to help maintain this while she continues to grow. Later on, we'll evaluate the wisdom teeth when she's done growing, and whether the wisdom teeth need to come out or not. Then I'll release her, I would prefer that an individual wear the retainer if they can at night, just to help maintain what we've created. So there she is to begin. There's the progress photo. There's the final photo. And there she is to begin with in a profile shot. And there's a final shot of her. And when we use my little plane to evaluate the profile, you can see that maybe it's not ideal, but it's drastically improved the profile. So that concludes my discussion. I hope you enjoyed it. Feel free to visit my website at www.dockiefferortho.com. That's DOCKIEFFER ortho, ORTHO.com, and click on our blog link to post any questions. Thank you for your time.